Okay, we're going to make a start. So, good morning, everybody, and welcome to our monthly Community Mental Health Transformation webinar. I'm Megan G, and I'm the Communications Manager for the programme. If you've joined these webinars before, I will be a familiar face. But if this is your first time joining one of the webinars, then welcome. Today, I'm joined by my colleagues in West Sussex, who are going to be talking us through what's been happening within West, the next steps and plans. And this is similar to the webinar that we presented last month, which gave an East Sussex focus. So we're coming over to West today, and next month we'll be doing the same for Brighton and Hove. So we've got a jam-packed presentation for you today. But just to make sure that everyone feels kind of settled and comfortable, we're going to start off just with some general housekeeping. So today's kind of different because it's the first time that we're hosting these webinars on Teams. So I'm glad you've all found us okay, and hopefully you're familiar with using this platform. But just to make sure that you can kind of get the best out of the experience today, just a couple of things. We will be recording the session, so it gives people the opportunity to be able to watch it back if they're not able to attend live, which is quite helpful. And also, if you want to watch it again and share it with your colleagues, friends, family, then obviously please do. Because it's being recorded, we just like to mention that obviously if for whatever reason you would prefer to anonymise your name or to keep your camera off, that's absolutely fine. Please obviously participate in the webinar however you feel most comfortable today. And then also, if it would be helpful, you can turn on live captions for the session today. So this is slightly different to when we've been on Zoom. So there'll be 3 dots on your toolbar that will say more. And if you go to language and speech, you can then choose to turn on live captions. So if you want to do that, then please do. We'll have approximately half an hour of a presentation today, and then we'll move into a question and answer session. So if you do have any questions throughout the session today, you've got a couple of options of how you can ask those. So we have got a Q&A box. You'll see a little speech bubble with a question mark on it. So if you do have questions throughout the presentation, you can pop them in there. And then at the end, when we come to Q&A, I can read those out and our presenters will respond. Alternatively, at the end, you can choose to raise your hand and you can come onto screen and ask the questions yourself. So it's whichever way you feel more comfortable to ask those questions today. And then after the webinar, and we always send round to everyone who's registered, I'll send around a copy of the slides, also the link to the recording if you do want to watch it back. And there's also a link to a very short survey, which we ask people to complete, as it's really helpful for us just to make sure that the webinars have been informative, if there's anything that we can do to kind of make them better, if there's things that you'd really like kind of more of or less of. So if you do get a couple of minutes to do that, that'd be really appreciated. Thank you. And then lastly, as I say, we record all of our webinars and we've got quite a large history of them now. I think we've been doing them since 2022. So we've got a YouTube playlist which has all of the webinars right back from then. So if you are fairly new to this program, or if you want to watch back kind of how it's all started and where we've got to now, you can do so by scanning the QR code that's on the screen. As I say, I'll also send these slides around, so you can do that later. Don't feel like you have to do it now. And you can watch back all of those webinars. They're also a really nice resource if you're trying to kind of talk about the transformation work with another person or in your team or in your groups or networks, as that's a really nice kind of library of kind of all the activity that's happened over the last couple of years. So do obviously use that if that's helpful. So that's kind of it from me. I'm going to hand over to our presenters, Kerin and Rob. I'm going to hand over to you both to introduce yourself, and then they're going to lead us through our presentation today. Thank you both.
Lovely, thank you, Megan. So I'll start by introducing myself. I think having looked at who's here, I know quite a few of you, and it's lovely to see you. But my name's Kerin Page. I'm the CEO of West Sussex Mind, which is we're a mental health charity based in West Sussex, providing services across the county as part of Pathfinder West Sussex and heavily involved in the transformation. But alongside that, I also have a small role supporting the mental health transformation as a strategic lead, so working with Rob and colleagues as part of moving the transformation forward. So it's lovely to see you this morning. And Rob, over to you.
Hi, lovely seeing so many people on the call as well, or the webinar. It's not a call, is it? It's a webinar. So I'm Robert Szymanski. I'm the Managing Director for West Sussex Division in Sussex Partnership Trust. So as you're aware, we provide a range of services for to support people with mental health conditions across the trust. And my particular focus is in West Sussex. And I work alongside a number of colleagues who have joined this call, but also alongside Karen and other partners to implement our neighborhood mental health teams.
Thanks, Megan. Would you mind moving on to the first slide, please? So you're going to hear from me for the first few slides. Starting with a bit of background, and I guess I just wanted to acknowledge for some of you this might feel like a bit of a recap or things you've heard before, but we don't want to assume any knowledge, and so we're going to go through a bit of the background for the transformations, the rationale, and some of the principles. And just to say, I guess there may be other more detailed questions you've got. We can do our best to answer some of those a bit later, but this webinar is sort of a bit of a high level update, I guess, on progress, and there will be some more kind of local communication and webinars planned. It's a live program. We are meeting weekly to kind of move forward some of the developments we're talking about, and we're in the thick of it at the moment. So in terms of the background, I mean, I guess as the slide says, and I don't just want to read these out, we are and have been seeing a significant increase in mental health need in the communities, and I guess there's a really an important kind of, I guess, case for having more responsive services, and I guess the picture on the right, which was produced as part of some of the community. So the communication work about the transformation, I guess, really serves to sort of illustrate that in terms of some of the complexity that people have in terms of finding support, knowing what's out there for them, and where the best place to go is. And I think that's been the same from feedback from staff and also for people accessing services. So there's a really compelling case to kind of do things differently. So as the bullet points say, there's been strong feedback nationally and locally, for years really, that people don't necessarily want more individual services with niche pathways where you have to sort of know it's there, go through a specific process, but they want what's out there to be more joined up. And we'll come on to talk about that in some of the principles in a bit. But it's to have seamless and there to be sort of really no wrong front door. And people had reported finding it difficult to access support. So there may be waiting lists, there might not be specific interventions in certain areas that they need, but also they had to keep telling their story, repeating assessments in different places, which led to a sort of a lack of continuity of care. And also that staff didn't always know what was out there, didn't always have the advice and guidance they needed, but often, and I think particularly probably for some of the voluntary sector or less specialist services, they were finding they were dealing with people with quite complex needs and couldn't always give them the support or care they needed. So really there's quite a compelling case for change, and hopefully you'll see through this background a lot of that is driven by the experiences of people who either need support, our communities, and also our staff, which is some of the voices we really need to hear in terms of designing the way forward. Megan, next slide, please. So in terms of the background, and I guess in the context, Rob will take us through a bit of the detail about some of how this is working in West Sussex in a minute. But in essence, the long-term plan from the NHS, which is the kind of the national programme that's driving this work, talked about the need for services to work more collaboratively and come together. And you'll see on the slides a list of different partners there, and I think some of you are reflected here today in terms of the local authority, in terms of primary care, particularly our colleagues in GP practices, mental health services, and also the voluntary sector. As you can see, that's at a neighbourhood level, so that's bringing people together much more locally in communities to improve provision and provide support. And as I said, Rob will talk a bit about the decisions that have been made about the footprints in a minute for West Sussex and what that looks like. So we've been working to the sorry, do you mind going back, Megan? Sorry. So we've been working to the community mental health framework, and that sets out how services should transform and be more joined up. And I guess points to emphasise that I know we've discussed in previous slides is this, specifically for adults and older adults, and there's a real focus around providing support with people with long-term and severe mental illnesses, and trying to address some of the gaps where people fall between services. And I think the last sentence on that bullet point is really important in terms of supporting people who perhaps are too unwell for support from their GP through primary care, but don't meet the criteria or haven't been unwell enough, if you like, in the past to get specialist mental health services, and it's particularly those people who we really want to improve the experience and support for. So a lot of it is, it's about building stronger partnerships and relationships between existing services rather than necessarily bringing in new services and significant new investment. So thank you. Next slide, Megan, sorry. So in terms of the principles of transformation, so these were co-produced over the last 3 years or more now as part of the programme, and I think hopefully some people on the call have been part of those conversations. But these are the 4 principles that have really driven the way the transformations move forward. So the first one's about personalised, complete care, so treating people as whole individuals and in charge of their own care. And I think that's really kind of crystallized in that last statement in that bullet point, which is no decision about me without me, which is really important. Already mentioned simple and seamless, but the model really needs to offer clearer and easy to navigate services with no wrong front door. So it's very clear that wherever somebody seeking support gets to in the system, that if that they're going to get support, and they don't need to jump to different places or have to keep repeating their story or have multiple assessments, which we know is really not helpful. The services are accessible and inclusive, so that they're high quality therapeutic environments, but really importantly, I guess, that they're as close to home as possible in people's local communities. And again, as I said, Rob will be talking a bit about the structure of those teams and how we'll be bringing that to life in neighbourhoods. And then finally, I guess that it's one team and that we're all working together. So, the voluntary sector, Sussex Partnership, our colleagues from the local authority, primary care, we are one team with shared leadership, and we're making decisions around supporting local communities, as a group. So it's a real cultural change, and that's probably some of the most exciting thing, I guess, around the transformation. Next slide, please, Megan. And then finally, before I hand over to Rob, I guess it's just important in terms of acknowledging the really important role of co-production in transforming these services. And I think we've got Duncan and Sarah on the call from Capital and possibly others, and Capital have been commissioned to support the co-production of the transformation in West Sussex and leading the Lived Experience Advisory Group. And you can see in terms of some of the key themes that are highlighted there in terms of co-production. That's their principles that have come out of some of the work that's happened around Crawley. So it may be later when we move into the kind of the Q&A section, they'd like to say a bit more about that. And certainly we've got a slide later about how you can get involved with the Lived Experience Advisory Group, because it's really important that as we move into mobilisation, the voices of people with lived experience and that co-production is still there in terms of driving forward the transformation and the changes we need to see in services. So Megan, I think it's next slide, and I'm handing over to Rob now.
Thank you, Karen. Really helpful update. I also spotted that there is already some activity in the chat as well, which is really great. And if anyone really wants to ask a question or share some positive stories in the chat, please do, and it's really encouraging. This is just a reminder for some, and also for some, it could be a brand new roadmap or a timetable, and it's sort of indicative, setting out a key milestones or deliverables and deadlines that we would like to achieve, recognizing that the transition to neighbourhood mental health teams across West Sussex, and indeed across Sussex, it's not necessarily a sprint, but it's more of a marathon. And our roadmap that's shared on the slide is building all the good work that partners in neighbourhood teams, as they are currently, so across ATSs or in district and borough councils, have done to date. So where we got to early in a year, we have made some concrete plans in terms of strategic leadership, how we want to transition from the existing structures to the new neighbourhood team. So that happened around January or in the first quarter of this year. So we have dedicated working groups, operational delivery groups set up in each of the places, and there is 2 in West Sussex as well, and we'll go to that in a bit of detail shortly. Early in a year, we also collectively across the integrated care system agreed footprints and equitable distribution of existing resource across West Sussex, and we'll be able to share a map of the proposed footprints or agreed footprints shortly. They very largely reflect existing boundaries of district and borough councils in West Sussex, and the key bit around that is that we try to align existing boundaries for physical health services with mental health services as much as we can, to really provide that holistic and proactive care to people in the community. We are in the process of setting up meetings, neighbourhood meetings and other strategic meetings to oversee that delivery. That includes collaboration on the neighbourhood footprint, that includes development of specific standard operating procedures, because we want every team to operate as consistently as they can, recognizing there's going to be some local variation needed to meet population of local needs. And also, hopefully that will take us, that sort of framework that we're building now, hopefully it will take us by October, early November, into more aligned working across all of the 7 neighbourhood teams in West Sussex. And we're hoping that by then we will have services that will form our core team within neighbourhood teams, including some alignment with our aligned services and wider networks. So we're hoping that the neighbourhood teams will really bring together assessment and treatment services provided by Sussex Partnership Trust, will bring emotional well-being service, will bring primary care on board, will bring other voluntary care sector on board as well. And hopefully from October, November, this is where that real work and embedding of new practices and learning from these new practices happens. So we could really finish that marathon, which I started at the beginning, from around February, March next year. I would like to point that this is sort of high-level map, and we recognize that there's lots to do. We also recognize that certain neighbourhood teams may be at different stages in this development, but the reason we have this roadmap to provide a broad goal or aim that we all would like to work to and learn from. Thanks, Megan. Next slide, please. I never thought I'm going to say that phrase, next slide, please, and here we go. So this is just a model of what I think our vision for the structure of neighbourhood mental health teams is, and you have probably seen this. And hopefully this is nothing new for you. But in reality, we want all of our neighbourhood teams to have a core team at their heart. The idea is that that core team will provide consistent, high-quality mental health care across local communities aligned to district and borough councils. We're hoping that this core team will be the foundation of each neighbourhood teams. They'll ensure there is a standard level of service and expertise, but we also recognise that there has to be local flexibility. So each neighbourhood team may look a bit differently because of the local population needs and local knowledge, and some of the other services that may be established in one team but may not necessarily exist yet in another team. So I think from that perspective, as much as we possibly can, we want to give each neighborhood team we want to give them some autonomy to determine the best way how they want to work together, with aligned services, and how they want to engage more broadly with the other support services around, which I really believe that will empower that local neighborhood team that brings together a range of partners to really tailor the connection with the local community, local patients, local people, local voluntary care sector, local primary care, and other providers, and really make the best use of that available resource within each team. Megan, next slide, please. When I spoke about the roadmap, I spoke about where we want to get to by October or early November this year. And this is where we really want to create that core team. And within that core team, we would like to, as a minimum, we would like to have services that cover our emotional well-being service, our Sussex Partnerships assessment and treatment services, our services that offer specialist support and care for older people, access facilitators, and that can really support physical health checks for people with mental health conditions, and some of the other services like employment support service. That's the sort of principle, that's the framework, that's what we want each neighborhood team to develop. We're not going to dictate, and we shouldn't be dictating how each neighborhood team will work. However, we would like to set some guidelines or expectations or minimum requirements. So we would like each neighborhood team to really have a daily huddle to understand what patients or people they need to support on a given day. Are there any risks emerging? Who is best placed to meet patient needs or the needs of the local community? We would like each neighborhood teams to also have regular multidisciplinary team meetings, wider network meetings, and also meetings with some other providers to further enhance and expand the neighborhood teams. And it does sound like there may be quite a lot of meetings, but even though I do say that word meetings, it is really about running day-to-day operational business of each neighborhood teams that meets the needs of the local population in the best possible way. And those initial meetings, huddles, MDT meetings, they're not just for the sake of meeting, but really it's about building relationship between our providers, between our colleagues who are going to be part of neighborhood teams, and bringing service users, patients, relatives, carers, and others on board in terms of the neighborhood teams. And as I said earlier, this is sort of a core requirement for all 7 neighborhood teams, but we do want to give autonomy to each of the teams to design how they want to run the daily huddle. What is it going to look like? What are the topics for discussions? How they're going to be reviewing people in the caseloads, and so on and so on. Thank you. Next slide, please. So you may have seen that already. If not, hopefully that you will recognize this as a map of West Sussex. And there are boundaries of those 7 neighborhood teams across West Sussex. What the integrated care system, so all partners across Sussex, what we've tried to do is to align the neighborhood team footprints with the footprints of either existing local community networks or footprints of other physical health services. I think the match is almost there, but we know sometimes there will be some small discrepancies just because of geography. But as you can see, our neighborhood teams cover Chichester area, cover Arran area, Worthing, Azer, Horsham, Mid Sussex, and Crawley. Population sizes in each neighborhood teams are broadly similar. There will be some discrepancies, but as you can see, the geography of some of those is variable across West Sussex. So if you look at Ader or Crawley, it's fairly urban, fairly small in terms of geography. When you look at Chichester or Mid Sussex, Horsham, it's quite rural, quite big geographically. So this is where we really want to give this autonomy to neighborhood teams to then design how they want to work for those respective local populations, recognizing the size of the footprint in terms of population, in terms of local need, but also in terms of geography and some of the challenges that we'll have. Thank you. Next slide. I'm going to hand over to Karen again, who will be much more eloquent at describing some of the benefits we hope this work will achieve.
Thank you, Rob. Do my best. Yeah, so obviously it's really important that, I mean, I guess, you know, going back to some of the why we were doing it, that we kind of clearly articulate the benefits, but also that we're really measuring the impact, and that's something that's being discussed through the transformation team at the moment, in terms of how to do that, setting benchmarks, and then monitoring that over the time, because it's really important. You know, this is I guess it's been described at times as sort of bit of a once in a generation change in terms of how services are delivered. So it's really important that we're kind of tracking that and monitoring it and making sure it really is having the impact that we need. So for service users, families and carers, you know, as I said, it's about people being able to access support with clear entry points and consistent messaging, going back to that sign kind of earlier, that example of people being set off in all sorts of different directions, what we really need. And there's been some great work that Megan's been supporting for the partnership. Thank you, Megan, in terms of, you know, putting together some really clear guidance and some principles around communication that have now been launched across Sussex. So definitely something that needs to be addressed. So reducing waiting times for support. So again, that's something that will be being tracked and measured, and hopefully by bringing services together and getting people to the right place, they can be seen in a more timely way, getting the support they need. Accessing services based on need rather than diagnosis, so moving away from what at times can, I'm sure, seem like quite arbitrary or kind of barriers for people to get in the support. Quicker and easier transfers between services and support running in parallel. So people not having to sort of approach another organisation or have another assessment if they need something different. That being a sort of, I guess, a behind the scenes process that the neighbourhood multi-agency sort of neighbourhood teams are leading on. There'll be more physical health checks, and that will be measurable, so people with serious mental illnesses get that support that they need. And we know that the health inequalities and some of the health outcomes for people with serious mental illnesses are really poor, and that's something that simply has to be addressed, and the evidence around that is really compelling. And also that there's more voluntary sector involvement, so that there's a wider range of support, and I guess a greater diversity of options out there for people, so they get support tailored to them that they really need. So those are the benefits for service users and families and carers that we're seeking. And as I said, those are things that will be tracked and measured alongside a range of other things. And for staff, so we want to make sure they've got that there's greater confidence to offer different types of support. So some of that will be support training they receive working in partnership with other people, potentially bringing clinical and non-clinical time together, and diversifying staff teams. Having more effective processes so that allow staff to get their patients' needs met more quickly, so that people can, if they're struggling or think someone needs more support, that they can talk to their colleague, who would previously been in another team or another organisation, as a colleague, to sort of make arrangements for that. Really important that we look at how we can reduce the time spent on admin tasks, referrals and so on, and actually allow people to spend more time providing the direct support, which we know from staff feedback is where they really get their job satisfaction, and also that's what has the biggest benefit for people who need support. So those are the benefits and the impact. I know there's some work happening at the moment on the staff survey to go out across organisations to get a bit of a benchmark. So again, there's things that we can go back and measure over time, so we know that the mobilisation, the change in ways of working is really having the impact that we want it to. Next slide, please, Megan. So in terms of slides. This is the last one from me, but I know, Megan, you'll touch on a couple of these things in a bit more detail. So there's 3 things we wanted to highlight in terms of getting involved. The first is around the Community Transformation Partnership, which is a stakeholder group that's been running for a number of years now, that I co-chair with Stina Borman, who's the West Sussex ICB lead for mental health, and also work closely with Rob and his colleagues from Sussex Partnership. So that's an opportunity for a range of different stakeholders, and there's some of you on the call today are members, to get involved in terms of providing input, but actually having some scrutiny over the plans and the implementation of the transformation across West Sussex. It says 6 weekly. It's a monthly meeting, so it's usually about every 5 weeks or so, and the next one is in a fortnight at the start of September, when we will bringing back a lot of the activity we've done over the summer, and updating the partnership on the work we've been doing and the updated mobilisation plans to achieve the goals we've set out within the timeline that Rob was showing earlier. And as that says in bold there is expert by experience attendance there provided by Capital, and I know Duncan and Capital, you've got a standing agenda item there about road co-production, which is always really helpful. We've then got the Lived Experience Advisory Group, which, as I already said, is held by Capital Project Trust as a space for people to get involved with the programme. And as I said, Duncan and Sarah on the call, so if anyone's got particular questions about that, I'm sure that they'd be happy to answer it, and we can make sure you're connected into that work. And then finally, there's the Voluntary Sector Mental Health Network, which is now hosted by our colleagues at Southdown, running Pan Sussex, which is a space for the voluntary sector to get involved with the transformation, to find out more. And again, Megan's got a slide about that, but that was relaunched last month, and there's a really exciting sort of menu of different activities that have been set up over the summer and going forward, and there's an inaugural meeting to find out more coming up shortly. So again, there's a link for how you can sign up to do that. So I think that's it for me, Megan, so I'll hand over to you for the closing bits, if that's okay, before we move on to questions.
Thanks, Karen, and thank you, Rob. That's brilliant. So yeah, just a couple of bits so before we move into Q&A. So as Karen mentioned, there are obviously lots of ways that we encourage people to kind of get involved, and there are lots of ways that you can obviously keep updated with how things are progressing, both for the Community Transformation Programme as a whole, but also those localised updates specific to where you live and work. So obviously there's the monthly webinars, which obviously you're here now, so you have found them, so that's great. We also have a monthly newsletter that goes out, and I'll circulate the link to how you can register for that if you haven't already. It's really easy. You can just subscribe, and then you'll receive them every month. As I mentioned at the start, you can also watch back previous webinars, and these are a really helpful resource for if you're trying to describe the transformation work to other people as well. As Karen mentioned, we've got the VCSE Mental Health Network. There's also a page on the NHS Sussex website, which it's got so much information on there, but it's basically our main go-to page for the Community Transformation Programme. So there it has all the information about kind of what it is, kind of why we're doing it, what we've been doing, and it's got all of the previous newsletters, all the previous webinars, and that's kind of the place to go for like the latest updates and information. There's also some resources on there that are helpful to download. There's an information pack, and within that it's got some kind of frequently asked questions that we've gathered through having obviously conversations like this and through events and workshops that we regularly update and review. So that's quite a handy kind of go-to resource. And then you can also email us, or you can email me directly, kind of whatever is easier for you. And then, as Karen mentioned, we have now got the Pan Sussex VCSE Mental Health Network, and I just wanted to include this in the presentation today. I won't read through it, as obviously I will be sharing the slides with you all, but I just wanted to highlight that obviously the 3 place-based VCSE mental health networks have now come together as a Pan Sussex group, which is being supported by Southdown, and they are running an introductory webinar on the 11th of September. from 1:30 until 2 o'clock, which you are able to sign up to. So I will include the link to that in the email that I send around later today. And also, if you have any questions about the webinar or about the network in itself, you can also contact them directly and they'll be happy to help. So just wanted to highlight that today. So we're now going to move into questions and answers. There's a couple of ways you can do this. You can either put your questions in the Q&A box if you prefer to not come on camera, that's absolutely fine. Or if you're happy to come onto camera and ask the question, then you can raise your hand. And Rob and Kerin and myself and others on the call will obviously then step in to answer any questions that you've got. So this is the bit where people get a bit shy and no one wants to be first. But just kind of a reminder that there's no wrong questions. This is very much a supportive space. Louise, thank you.
Hi there, thank you all. That was really helpful and really kind of positive to see those changes that will be happening. I've got two questions. One is around staff training. So Rob, you mentioned SOPs and embedding new practices. So I just wondered if you had an idea of what the training for staff in operational roles will look like to be able to carry out that new way of working. And also there's one about data. Am I right in thinking that the community, neighbourhood teams will be working in different organisations? So will there be challenges around recording patient information on different systems?
Should I answer the data question first? So one of our milestones in terms of our roadmap is around ensuring we have access to data, but we also know, or to shared data or shared record, we also know there's lots of information governance and confidentiality issues to address. So I think as part of that work, we probably won't get there with full data or record sharing by October, November. Having said that, specifically for Sussex Partnership Trust, we are rolling out our electronic patient record over the next year or so, and that's linked with some of the IT system that primary care colleagues already use. And I also know that some of our voluntary care sector partners are aware of that as well and may have some access to this. So I think it's a challenge. I don't think we're going to recognize. I don't think we're going to resolve it immediately on the 1st of October, 1st of November. And that's going to be one of those things that each team will have to work through, but collectively as a trust. Kerin, I think you have.
Yeah, I just thought I'd probably just jump in on that as well. Hi, Louise. So yeah, I mean, I think, yeah, you're right, Rob. That's definitely not going to be sorted for October. But I suppose just to say there's a really big piece of work happening across the system to look at digital solutions and information sharing. So it's going to be a priority, and well, it is a priority and we will get there, but it's probably one of the more complicated issues because, as Rob said, it relates to IT solutions, information governance and individual sort of organisations. But I guess just to reassure you, in the interim, there are individual solutions in place for each of the places, and for West Sussex there is a plan to make sure information is shared where it needs to be to ensure patient safety and oversight, but also that we're meeting all our reporting requirements up to the Integrated Care Board and to NHS England and the data set. So that there is a plan. It's a bit clunky, but it works and it's been tested and rolled out. But yeah, medium term, we should all be moving to a shared system that should make things much more straightforward. But yeah, I'll hand back to you, Rob, for the other question.
And in terms of the training, so as part of our project plan for all of the neighbourhood teams, there is a section around the undertaking training needs analysis, what additional training may be required, and then how do we roll this out. And some of the training will be probably delivered in individual organisations, but some of that may be rolled out across the trust. So if there's anything, let's say, about risk assessment or care plans, or making sure that every contact counts and shared decision making with patients, that hopefully some of those will be rolled out across. So hopefully by October, November, each neighbourhood team will be able to have a training needs and analysis as well. We are engaging with our OD or department as well to support not only the the practical skills and knowledge and experience, but also the sort of cultural aspect of bringing together such a variety of people. Because it's not only being able to do the risk assessment, but actually then how do we work with, how do I work with Karen together in a neighborhood team, or how do I work with services? There's also that aspect as well, and I'm hoping that the training need analysis will recognize that. When I was going through that the course structure of the team, and I saw there's a meeting for this, there's a meeting for this, there's a meeting for this. Actually, some of those are also part of the training offer, so to speak, to go through that norming, storming stages of the teams coming together and learning how they operate. So I'm hoping that provides you a bit of assurance that it's not something we forgetting about, because it will be quite critical to do it. So yeah.
Thank you. Just thinking about the Staying Well Cafe, so
Yes.
Karen knows why I'm asking, and I think there's probably some kind of learning to take forward from that, and kind of, you know, what did we do in this situation, and will that kind of give us a bit of an idea of what to expect. And thank you.
Thank you, Louise. Mel, would you like to come in? Oh, I think you're on mute, Mel.
See, and I was asking if you could hear me properly because my computer's upgraded, so everything's changed place, and that only happened about 20 minutes before we came on air.
We can hear you.
Some of this is sort of backing up and completely confirming that what you're saying is it's not just us in here thinking, oh God, how should we do it? Things are definitely being heard, because I'm doing some voluntary work with the ICS as well. And for example, one thing we spoke about, the different services communicating together and working properly together, and it not being a great big lumber, is something that's being looked at not only at you, no, it's being looked at for you. So these are things that are not just being left sitting on the sideline. They're definitely being thought of, and how do we, well, and it's, the great part is it's never assumed that mental health will get in there somehow, or certain different, you know, medical conditions. It's definitely being considered for everybody. The voluntary sector involvement, again, is another thing they're talking about very strongly. And I might have raised the idea of the EBE, because this way we will continue to get far more out of our EBEs. They will feel value, which will make them want to put more in. And there are many other people in the ICS, ICB, ICD who really actually are strongly of the same opinion. So it's not us just going, right, well, I don't want it to look like we're backing them too firmly. So, you know, they'll find a way. It's very, very firmly being looked at. And then a great one, finding out how the staff are feeling and reacting. Have you heard yet of the Insight Bank? Because that is being very, very strongly looked at and it's being pushed forwards like crazy, because the work I'm doing isn't of any authority, it's voluntary sector. So what can you put forwards? And the Insight Bank is going to be spread, that people are they're going to want information from everybody. And the great part of that I can tell you now is, if you went on YouTube and typed in Sussex Healthcare Insight Bank, you'd be able to watch the most brilliant link, and things go from there. And then what I'll do is I'll see if there's a link that I can send out. But there's another lady involved in this for Sussex Healthcare, that is, well, SPT. Don't want to tread on her toes until she's ready, because she's part of an involvement team. But there's an awful lot of answers in the system for the questions that we're asking in here. It's been very good to hear that actually, yes, these things are not just being registered and assessed and we'll keep an eye on them. And the great one is computers. Because IT Mel Smith might have opened her mouth a bit, and got so many relieved faces of everyone has different abilities, different methods within their own structure, and different access to computers, and not everybody is as stringently good on them as others, and that is not being taken for granted, just saying no, but what they'll do is training. Okay, it's also being taken into consideration, and just wanted to let you all know, because you're part of a very good brigade, is that actually we're not just being heard and written down and noted. Yeah, right, things are being noticed and considered and absorbed, and it's not, yeah, well, they'll get on with them. And the wonderful part, and I know Megan is going to laugh at this one, but they have heard the phrase, well, I've had one of my bright ideas, and then which they will go, oh God, what's it going to solve this time? You and your bright ideas. So if you think of anything that you want putting forwards, the great part is like the Q&A at the end bit. You don't have to do it, but I can put something forwards because they want to know. I've got a bit of an upmarket. Making a governor job title look rubbish, because I'm an ambassador. Oh my God, I can't spell that. It's like governor. Do you go OR or ER at the end? So if you have something you want putting forward, do tell me, and I've got some lovely people I can put it forwards to and say, this is something that's rising, and not say, we need an answer right now. But what the questions we've been asking in here over these meetings really are being spoken of out in the big outside world, and it's not just only us saying, well, what we've got to do is, oh God, how do we do it? There are other people, and that's more than 3 or 4 trusts, all saying the same thing. So it's a conjoined effort. So
that's really good. Really good to hear. Thank you, Mel. And I know you've been a real supporter of this programme, and yeah, thank you for that. It's great to hear what's the positive feedback, and I think it's really great as well that you highlighted the Insights Bank, because that is a great resource and definitely something that I will highlight to the programme team to make sure that we are really using that to its full benefit, as there is obviously such a wealth of knowledge and information.
The thing is they can do something anonymously. They can forward it on, and if we just created a staff login, so then they can enter their own 4 digits, but then those are registered to them, but it would go to the Insight Bank as completely anonymous, or they can be named, whichever they prefer. But that way their views are not just being negated, and yeah, all right, they know they've gone forwards. And the beautiful part, and it's it's like these, there's only a fair few hundred to watch if you want to go back and have a look, and it's really worth seeing them. I can send you the link of the last one, and would you like that, Megan? And then you can send it out to the people who are relevant.
Yes, that's great. Thank you, Mel.
It gives you the whole structure on how to get things moving, if you want. But it gives you the link of, I can look back at that. That would be good.
Thank you, Mel. Yeah, if you can share that with me, that would be great, and I'll share it on. We have had some more questions come in, so I'm keen that we can get to as many as possible. So we've got a question here from Vanessa, and I know this is something that we've spoken about quite a bit within other kind of meetings and forums, and a question that a lot of our service users and carers have asked. You know, what do we envisage happening to the role of lead practitioner within the new neighbourhood teams, and do we envisage that this is going to be replaced by another role eventually, and would their duties be the same? Kind of what are the plans around that role as we know at the moment?
So if I just, we are not planning to remove the role of the function of a lead practitioner, as far as I no, and I'm hoping that won't change. All the functions of the existing assessment and treatment services will continue to be provided by the more enhanced neighborhood mental health teams that bring together other partners. And I think we all recognize the value that the lead practitioners bring to patients and service users that are on or that get and seek support from our neighborhood mental health teams. So just for reassurance as that, I think what we're trying to do through the neighborhood mental health teams, and Karen, I'm sure you'll be able to provide update on as well, is to make sure that if a person needs support from a neighborhood teams, that the lead practitioner is aware of this, but also the person or the service user, the patient, get the most appropriate support from the right member of function of the neighborhood mental health teams, which may not always be the lead practitioner, but maybe someone from Mind or someone from South Downs, or maybe someone from emotional well-being service.
Yeah, thanks, Rob. I don't think I have got anything to add. I think that sums it up nicely.
Thank you, Rob. That's brilliant. We've had lots of questions come in, which is brilliant. This is a really helpful question. So when new neighbourhood teams are live, how will a service user be able to access that team? How will it work?
Karen, do you want to kick off and I'll contribute?
I'll do my best. I mean, I guess we're working on that at the moment. There will be multiple different access points. I mean, I suppose people currently are, so what we'll be doing for each area, and I guess that's where some of the detail needs to start being taken forward by the local neighbourhood mental health teams. There might be some differences in each of the places based on the sort of the current access, current sort of layout of services and different routes and so on. I guess the most important thing will be should be some really clear information that's available on the website. There will be leaflets, there will be posters in GP practices and so on. And I suppose the most important thing is wherever anyone goes, they should get into the team. And I suppose that's probably the key principle. So because people are currently finding their way into services through different things, so they might self-refer themselves to Mind through the website, they might go and see their GP, they might do something else, and I guess we don't want to limit those options, but we do need to make sure everything's funneled into the neighbourhood mental health team, and it's as clear and accessible as possible. I don't know what you'd like to add, Rob.
No, and thank you, Karen. So I think it's however people access services now, for the time being, that will absolutely continue. And just for reassurance, for instance, in terms of assessment and treatment service, if you have a regular contact with the team and using one access method, that will continue. Again, I think what we're trying to achieve via neighborhood mental health teams is whether you will contact Mind, whether you will contact access facilitator via emotional well-being service, whether you will reach out to your lead practitioner, that actually then that neighborhood team comes together and subject to agreement and patient confidentiality are able to talk through the individual circumstances to make sure that the right and appropriate support is provided. And I think one of the slides said, I think there was a bullet point that said no wrong front door. I think that's what it said. And I think that's what we're trying to do. Obviously, as the footprints for some of our neighborhood teams may tweak slightly, they largely reflect what the existing footprints are, but they may tweak on the boundaries. There may be some practical change further down the line, but actually everyone will find, or every referral, every request for access and support will find its way to the right neighborhood team.
Thank you both. That's really helpful. I think we've probably got time for one more question. We have got more questions in the chat. So what I will do is I will make sure those are all kind of pulled out of the chat and that we do form a response to those questions, which I'll then circulate round to everybody who's registered for the webinar today. We'll also be updating our frequently asked questions. A lot of the questions asked today I think will be very helpful to have within that as a resource kind of for others as well. So I think we've got time for one more question, but all the other questions will get a response just via email. So I wanted to ask this one. How will triage into services change?
So there will be a, from my perspective, I think the triage will be enhanced. So all referrals in terms of and if there is an indication of crisis, they will obviously manage appropriately. And if a patient or a service user referred is in the immediate need of support, they will actually triage and refer to appropriate urgent response service. For other referrals, I think by setting up a daily huddle in neighborhood teams and then a regular multidisciplinary meeting, this is where that really multi-professional experience and input into the clinical professional triage, I think that'll be that change. That will be that change that really enhance the offer for people and services and patients that are referred to the team. So I think that it's going to be, rather than revolution to triage, I'm going to describe as an evolution to triage and better enhancement because of the input of all other system partners or partners that sit around that neighborhood teams as part of the core team. That's how I would say it. I'm not sure, Karen, if you...
I agree. And I suppose just to say briefly, as probably many of you on the call may know, there have been multi-agency triage hubs in West Sussex for some time, where a variety of different partners come together to discuss referrals with the view of, and you know, I guess so far that's really been around the no front door, wrong front door principle. So if somebody's received an referral that's not right, they can go and make sure they can hand that individual over to someone who can provide them support. So I think there's a lot to build on.
Thank you, that's brilliant. So apologies again that we haven't been able to get to everybody's questions. It's great to see that, yeah, people have so many questions. Rob, did you want to come in?
Yes, sorry. I know you want to finish, but I just wanted to assure that we'll answer all of the questions because there's lots of them in the chat. There's lots of positive comments. And I was wondering whether people could comment what would be helpful for the next webinar. Sorry, Megan, if I'm just stepping on your toes.
No, not at all.
Other things.
Yeah. Yeah, no, that's absolutely great. And yeah, as Rob said, we will respond to all of the questions that have come through today, and we'll share that with everybody so that it will be done obviously in very much a public and transparent way. We also will update the frequently asked questions that will be on the website in case the questions other people have got as well. The next webinar will be on Wednesday, the 18th of September at 12 o'clock, and we'll be going over to Brighton and Hove for an update from them. So it'll be a very similar format to today. So if you do work in kind of a pan Sussex role, or you have an interest kind of what's working and happening in the transformation more broadly, then do obviously register to come along to that. I'll include the link as to how you can do that in the email that I send around later today. And just kind of to reiterate, there are obviously various ways that you can obviously get in touch with us within the community transformation programme, as well as obviously colleagues directly within West Sussex. If you do have any other questions that you think of once the webinar has ended today, the opportunity is still there, so do obviously reach out to us, and we'll obviously help in whichever way we can. But just thank you so much for attending today. I know that everyone's incredibly busy, but I hope that it's been obviously helpful and informative. And we will obviously be revisiting West Sussex again in the next couple of months, so I'll let you know obviously when that webinar date will be. But just a big thank you to Rob and Karen for leading us through the presentation today. And just, yeah, thank you so much everyone for attending, and I hope you have a very good afternoon. Thank you.